Good afternoon. My name is Alexa Strong, and I'm doing my disease project over trichomonas, aka trick. What is it? Trichomonas is a sexually transmitted disease. It's very curable. The name of it is trichomonas. This is trick under the microscope. It's a single cell organism with wing phalanges coming off of it. The life cycle. Trichomonas, it resides in the female lower genital tract and in the male's urethra and prostate. There is where it replicates by binary fusion. The parasite does not appear to have a cyst form and does not survive well in the external environment. Trichomonas is only transmitted among humans and it's primary by sexual intercourse. Here's the life cycle. Okay, one, it starts off in the female urinary vagina, in the male's urethra or the prostate. Two, it multiplies by binary fusion. And three, the trophozoan in the vagina or the in the urethra, and only where it is and then it get diagnosed after you have some symptoms, and some people don't have symptoms, and then it's cured. The structure of the trichomonas is a single cell protozoan. It's a that's the parasite that causes trichomonas vaginals. How's it transmitted? Trick is a parasite passed from one infected person to an uninfected person during sex. Women are the ones that mostly have it. And if they're affected, it's in the lower genital tract, which includes the uvula, the vagina, the cervix, or the urethra. And in men, they most commonly affected body parts is inside the penis, which is the urethra. Signs and symptoms. The signs and symptoms in men. Most people don't show signs and symptoms. Some people do. The men signs and symptoms of trichomonas include itching and irritation inside the penis, burning after urination or after ejaculation, and discharge from the penis. And in women with trichomonas, they have itching, burning, redness, or soreness in the genitals, discomfort in urination, and a change in their vagina discharge. Then thin discharge or increase in volume that can be clear, white, yellowish, greenish with an unusual fishy smell. How is it diagnosed? There are multiple ways it could be diagnosed. It could be diagnosed. It could be but it cannot be diagnosed just by symptoms because they may think it's another sexually transmitted disease. But it could be diagnosed by a wet preparation, which is where the doctor take a swab and swab the inside of a lady's vagina and put it on a little script and look it up on a microscope. Then they can use a culture test using urine or a swab from the vagina or urethra and make the trick grow inside a lab. That'll take a little longer. It's harder to diagnose in men because you really can't, like, besides taking blood from them or putting them through that pain. How is it treated? It's treated with medication, either tromethazone or tendinazone. These pills are taken by mouth. You will take them for about 10 to 12 days without alcohol. And when you have sex, put on a condom or make your partner wear a condom. People who have been treated for trichomonas can get it again. In the prevention, the most common way to not get tricked is not to have any type of sex, which include vagina, anal, or oral. Use the condoms the right way every single time you have sex. This can lower your chances of getting tricked or any other sexually transmitted disease. And always get tested. The statistics: 3.7 million people have the infection, don't know it. Some do, some don't. Some have symptoms, some don't. 30% develop any symptom of trichomonas. Women is more likely to have it than men, and about 1 in 5 people get affected again within 3 months after receiving treatment. And that's where I got all my information from. Thank you.